Welcome to Defense Art TV. I'm your host, Sifu Robert Brown. Today's show is about body targets, what happens when we strike them. It features Dr. Mike Savona, Hawaii's Doctor of the Year for 2003. So stay tuned for the effects of striking vital zones on Defense Art TV.
Aloha, my name is Sifu Douglas McLeod. We have our special guest, Dr. Savona. Thank you for coming.
Very welcome, David. Now, the ear. The ear is a place where there can be a lot of things done that can cause a lot of trauma to somebody. You have to be careful about this, but it's a good way to disorient somebody and create an advantage for yourself. This represents the ear as we see it structurally here. We call this the pinna of the ear, or the part of the external ear. External ear actually goes from the outer surface of the ear through the ear canal to the eardrum, which is known as the tympanic membrane. Okay. After the tympanic membrane, right in this area here, the tympanic membrane is just this smaller white area here. This area here is called the middle ear. That's where our hearing occurs by movement of that membrane, and then it's picked up by nerves. And then this up in here is something called the labyrinth, or the inner ear. The labyrinth is a series of canals. You can see them. There's 3 of them. They're fluid-filled. They act like carpenter's levels. They're what tell us, our brain, what position we're in. Now, the brain depends on 3 areas to determine what position your body's in. One is the ear, which, for reasons that defy explanation, it tends to depend the most on. The other are your eyes, which tell it information about what position your body is in space. And the third is all of the millions of nerves that travel throughout your body that the brain then takes that information, constructs a picture of where you are. Now, these act like carpenter's levels, so if you're tilted, you have that sense that you're tilted. If you're level, you have that sense that you're level. Probably everybody has had the experience when they've had a cold and this area gets inflamed that they feel dizzy and like the room is spinning. And we call that vertigo. And what that's caused by is when that area is irritated, a reflex motion is set up in your eyes to make them shift from side to side, which is what keeps ice skaters. Anybody wonders why people who are out there twirling on the ice skates faster than you can see don't get dizzy? It's because they've learned to do this. They can actually quiver their eyes back and forth and pick out one spot and keep focused on it as they spin. Okay. We call that movement nystagmus, but this is what constitutes vertigo. So what can you do here? Well, it's simple. An ear clap. Okay. An ear clap that is successfully executed creates a wave of pressure that goes up the eardrum, can actually perforate the eardrum itself. Okay. The perforation causes an intense amount of discomfort, will probably, if not permanently, but transiently interfere with their ability to hear, and causes a great deal of stimulation to this labyrinthine system. So you now have an opponent who is miserable from pain, probably not hearing very well, and is acting like the room is spinning, like they're on one of those rides at the fair. So this is a very easy area to strike, and all it takes is an ear clap on both sides. One side's sufficient, but both sides would be the ideal. And so in many of the techniques, we talk about this. The 2 spears technique may be initiated with an ear slap first, but there's lots of things that you can do. But also this is an area that obviously in training you just want to be careful because it can cause a great deal of discomfort. This over here is the eustachian tube. This is the tube that equilibrates pressure in this region with the back of your throat. We've all experienced this phenomenon when you take a plane trip and you go up and your ears kind of plug up, and if you blow hard or chew something, it opens up, and that just allows equilibration with your throat.
Divers are really common.
That's right, for divers this is very common. There's a little bit more of the anatomy of the face, and again, a couple of reasons to show it. One is that there are, the yellow are, I'm sorry if I'm in anybody's way over here, the yellow there's a lot of nerve complexes in the face, and there's a lot of vascular structures in the facial region itself. But again, the point that I would like to make is that the scalp is very vascular, and it's an easy place to bruise somebody with a blow and create hematoma very quickly. Anybody who's had an occasion to fall or hit their head will, recognizes how quickly they can get a sore lump there. Okay, and that's because the scalp itself is very vascular. And like I've said, there are a lot of nerves in this region. There are a lot of nerves in front of the ear and coming down into the neck, and just a lot of vascular structures. This right here is the parotid gland on the side that covers the angle of the jaw, and that's what's so uncomfortable when you press over here. And like I said, it doesn't take a lot of pressure on that angle, just behind that angle of the jaw, to make you a little bit uncomfortable. But that's an area to grapple with, and of course you can see how the jaw comes up there. There's space between the ear and the jaw to work a finger in there and actually dislocate the jaw. Okay, and here's a little bit more of the same, showing the muscles of the scalp and the parotid gland again, and it shows a little bit more of the anatomy of the jaw itself. The jaw actually, if you put your finger in your ear and open your mouth, you can actually feel the articulation of the jaw against your skull, because that's where that joint is. Okay. In the neck now, moving from the head to the, and if anybody has any questions, just sing out. We can.
What is cauliflower?
I'm sorry, cauliflower ear. Yeah.
Why is that?
Well,
when you bang on the ears, it's,
what happens with that? The ears are mostly cartilage, and there is just a small area of skin overlying it, and the subcutaneous tissue, the tissue between the cartilage and the skin, is very, very little. Now, it's more common with boxers who take a lot of shots to the side of their head. And when you think about how fighters stand, they stand like this, and they're bobbing and weaving and always turning, and they take a lot of side roundhouse punches to the side of their head. What occurs is bleeding occurs between the skin and the cartilage, and you develop lumps and bumps in this that then solidify and scar. And they gave the appearance, if you've ever seen a head of cauliflower, all the little bumps on it. So that's what they call a cauliflower ear.
I'm gonna let you go. All I'm really doing here is dropping to the floor. That's it. But I've got him locked in my arm. For practice purposes, I keep a really light touch so he can just pull right out of it. For application's sake, I got it really tight. When I do it really tight, it's going to do damage to his neck and those sorts of things. That's why it's real important to play like feather touch. Really, he starts his takedown on me. Hey, what am I going to do? I'm going to negate whatever it is he's doing. In addition, in this system, I'm doing things. As soon as I do this, his natural reaction should be, okay, retreat. Okay? It's either that or you just lost the eye. Now he continues the fight with one eye. Okay? The same thing, he grabs. I'm going to continue what I'm doing. I'm going to strike the same way you strike free sparring. The reason why you don't hurt people within your own system is they're family members. In terms of realistic self-defense, in your back of your mind, you have to realize that when I do this, that ain't going to pay. He's not going to pay attention to it. I have to put something with it. Those something with it is what opens doors. That guy sets up to nail you. He's wide open. What's the attack? The leg. He just saw me put all my weight on that leg. So no matter what I do, he's doing a leg takedown. I'm down. And all my body weight's on all those dangerous little joints, ankle, knees, those sorts of things. So from your sparring mentality, you have to go to a clinching mentality. You do that by closing the distance.